Hello all, I'm Mrs. Winnie Matthew, nursing tutor working with Oyster Nurses Academy, Kerala. We provide guidance for the prometric examinations to different Gulf countries, Saudi, Oman, Qatar, Bahrain and UAE. Today, we'll see about ataxia. Ataxia describes poor muscle control that causes clumsy voluntary movements. It may cause difficulty with walking and balance, hand coordination, speech and swallowing, and eye movements. We'll move on to the symptoms of ataxia. Poor coordination, walking unsteadily or walk with the feet set wide apart, poor balance, change in speech, difficulty with fine motor tasks such as eating, writing or buttoning a shirt, involuntary back and forth eye movements, difficulty swallowing. Moving on to the causes of ataxia. Damage to the part of the brain that controls muscle coordination or its connections can cause ataxia. There are three major groups of ataxia causes: acquired, degenerative diseases, and hereditary causes. First, we'll see about the acquired causes. Alcohol use, medications. Ataxia is a potential side effect of certain medications, especially barbiturates and some type of chemotherapy. Toxins. Heavy lead or mercury poisoning can cause ataxia. Vitamins. Not getting enough vitamin E, vitamin B1, vitamin B12 or thiamine can lead to ataxia. A deficiency or excess of vitamin B6 deficiency also may cause ataxia. Thyroid problems, autoimmune diseases, infections. Ataxia can be uncommon complication of chickenpox in childhood and other viral infections such as HIV and Lyme disease. Then stroke, multiple sclerosis, COVID-19 infection, abnormalities in the brain, head trauma and cerebral palsy. Next is the degenerative causes of ataxia. Multiple system atrophy. This affects adults around age 50. In addition to ataxia, other problems associated with this condition include bladder incontinence, low BP or fainting on standing, and REM sleep behavior disorder. Next is the hereditary causes of ataxia. Some types of ataxia and some conditions that cause ataxia are hereditary. If you have one of these conditions, you may have been born with a mutation in a certain gene that makes irregular proteins. Moving on to the diagnosis, we'll be doing physical examination and a neurological examination. Also, checking the vision, balance, coordination and reflexes. Other tests includes blood test. These might help identify treatable causes of ataxia. Imaging studies, an MRI of the brain might help determine possible causes. Lumbar puncture and genetic testing. Genetic testing to determine whether a gene mutation causes one of the hereditary ataxic conditions. Moving on to the treatment. There is no specific treatment for ataxia. In some cases, treating the underlying cause may help improve the ataxia. In other cases, such as ataxia that results from chickenpox or other viral infections, it is likely to resolve on its own. The adaptive devices. Ataxia caused by conditions such as multiple sclerosis or cerebral palsy might not be treatable. In that case, doctor may be able to recommend adaptive devices. They include hiking sticks or walkers for walking, modified utensils for eating, communication aids for speaking. And the therapies includes physical therapy to help coordination and enhance mobility, occupational therapy to help you with daily living tasks such as feeding yourself, speech therapy to improve speech and aid swallowing. Thank you. See you all soon with a new video.